How much would it cost in the United States? I don't know, 60, 70,000, something. I mean, it's outrageous. And now that should be number one topic. How do we deal with the outrageous costs of healthcare in the United States? How much of healthcare is paid on insurance? How much of our healthcare dollar is insurance? I think I looked it up. You'd have to check. Something like 28 cents, 31. I mean, something ridiculous. Does it employ a lot of people? Yes. Do we have to take account of that? Yes. Do we have to think about how to move them into other kinds of employment? Yes. But does that take precedence and profit for these companies over healthcare? Is that what America wants to be? Hello, everyone. I'm Dr. Neil Baer, co-director of the Master of Science in Media, Medicine, and Health program at Harvard Medical School, and you're listening to the Public Health Insight Podcast.
Stories don't just entertain us, they can also have a meaningful impact in how they shape our understanding of the world. With me is Dr. Neil Baer, a physician and Hollywood storyteller behind iconic shows like ER, Law & Order SVU, Under the Dome, and Designated Survivor. In this episode, we continue our conversation focusing on real-world issues like HIV, the stigma, public misconceptions, and how much it costs for treatment and prevention. We also chat a bit about how the costs of insulin are inflated to mind-blowing levels in the US. Remember in the early parts of our conversation how we talked about that many people get key information from watching TV? Well, in this conversation, we also get into problematic portrayals that can unintentionally mislead an audience. At the end of the day, stories on the screen or any other medium allow complex science and big social issues to be humanized and gives the audience a portal to connect.
So because of everything I've talked about, my love of storytelling, my love of integrating health and medicine into not only ER, but SVU, Under the Dome, they ran out of insulin. What are they going to do? You're going to die unless you can slaughter pigs, and that's what they used to do, but then they ran out of pigs. Designated Survivor, U equals U. We did a big storyline. What is that? Undetectable equals untransmissible. What is that? Somebody with HIV who is treated will not give their partner HIV, even if they don't use condoms. So undetectable means that you don't detect the viral load, even though the patient still has HIV. You just don't have enough to transmit. So undetectable equals untransmissible. And then we also have what's called PrEP, prevent HIV, from a person who's negative, and they won't get it. There's a new PrEP out that's coming, that's 2 injections a year, costs $42,000 for the 2. It's been shown 100% effective in women who were tested using it in sub-Saharan Africa. Who's going to pay for this? So Gilead, who makes the vaccination, and they also make PrEP, is giving a license to a number of places to make generic. It's estimated that it really costs about $46 to make the vaccination. So Gilead will argue this is all the research, et cetera. And that's another whole issue over PrEP and the drugs, because the government is arguing that they got money from the government NIH to do their research. And so that's a legal case that's ongoing, because if you get money from the government, you have to make the drugs available.
In the southern states of the US, systemic barriers prevent access to life-saving HIV treatments, like PrEP. The numbers tell one story, but the real lives behind them reveal another. Dr. Baer unpacks how stigma, healthcare inequities, and cultural dynamics intersect, and how storytelling can bring these hidden struggles into focus.
How many Black men who are gay or queer having sex with other Black individuals in the South, or non-Black individuals who are queer, are HIV positive? It's about 50%. So Black individuals who have sex in the South with people who are HIV positive who have sex with queer people will be HIV positive. Why is that? Stigma, access. This is data you can find in the southern states. In Los Angeles, the last time I looked, it was 40% of Black men who have sex with men are HIV positive, 20% of Latinos, and 10% of white men. So why is that? Well, if you go to West Hollywood in Los Angeles, there are testing vans everywhere. Now, if you go to Compton, there aren't. It's expensive to get PrEP if you don't have insurance or you don't qualify for Medicare. There are places that give it. Gilead gives it for free, but only, not to the numbers that need it. There's stigma, there's shame, there's the church, there's a lot of reasons. So, but what's so compelling about that data point is that HIV is pretty much preventable. If you have it, we can treat you and you'll live a better life. If you don't have it, we can treat you and prevent it. But there are barriers. So I brought this up in my show, Designated Survivor, empirically based, about a young man, the social media maven, who's gay, has sex with his partner, a Secret Service agent, doesn't tell him he's HIV positive, tells him after they've had sex, they use a condom, but he still tells him after. His boyfriend rejects him and says, "You didn't give me a choice." And he said, "That's why I didn't tell you, because I was afraid, because I knew you would reject me. But there's no possible way I could have given you HIV because I'm protecting you and myself. And because I'm the writer, I can break them up, but of course, bring them back together at the end, which I do because his boyfriend goes and finds out the information and finds out." Now, we did this. This is a story that brings up HIV, but it makes it very personal. Like I'm, this young man who's always rejected. So I'm going to take care of myself and make sure that there's no possible way you can get HIV, but still there's so much misinformation that he's rejected. But we also get the emotion. He's afraid. He'll be rejected. He'll be seen as dirty, which is in the scenes. We understand his boyfriend's position. "You didn't give me a choice. You didn't tell me." Our character says, "You didn't ask me. Isn't it up to you to ask?" So you're able to bring up all of these amazing questions that happen in life. People are sometimes embarrassed. They don't want to ask. So now I did have an argument with Ricardo Perez Gonzalez, who's an amazing writer producer I work with a lot, because he's queer and he didn't want to show the condom wrapper. And I said, and this was on Netflix, who were super supportive. And I said, "I think we need to." We were the two gay writers in the room. The other four were cisgender, straight people who didn't, super supportive, but they didn't really understand, being undetectable is not being in remission. It's not cancer. And they were like, "Wow, you have to tell." And I thought, this is going to be a great story because everybody's kind of edgy about this.
Representation matters, and Dr. Beer is quite intentional about it. By showcasing love and intimacy between Black queer characters and addressing trans issues on screen, he challenges outdated narratives. These stories don't just reflect reality, they push an audience to rethink and open their minds.
So, of course, there was a lot of talk about this episode. And I said, we should use a condom wrapper to show. And also, I like showing two Black men in love, not from Pose or, a show from 25 years ago, which is great, but to do it now. A loving relationship between two Black men. And, that freaked out people. I was reading on what was Twitter, but now X, like, "Oh, your show used to be," I didn't do it when it was on ABC, "used to be a family show, and now there are two Black men in bed." And it's like, oh, good, they saw it, because they wouldn't be writing about it. So it's like, yeah. This is another thing about TV, which is maybe it opened a few people's eyes. And if some people, are angry about it, at least they saw it. And it maybe is the beginning, because, people saw Will and Grace and Modern Family, and now we have gay marriage, at least we still do. So the point is that we can do these shows that are anchored in big social issues. And we showed a condom because I didn't think the audience was ready for so many elements, like all of this. I wanted the audience to focus on U equals U, not on the fact that if there is no condom, he still wouldn't get HIV because he could still get other sexually transmitted infections. And I didn't want to go down that road. So I do have like the freedom and leeway to kind of make those decisions as the showrunner. I did another episode with Jamie Clayton. She's a trans actress who is kicked out of a bathroom in Washington, D.C. I didn't know that the, deplorable, as Hillary Clinton said, Nancy Mace, would make this her key political, cudgel and be so horrible to trans people, so that she could, I guess, get the Marjorie Taylor Greene Award for being the worst person in Congress. Well, with Lauren Boebert too. So, it's really incredible to be bullying a congressperson because they're trans and not knowing the data and, jumping on a wagon to get the media's attention and being so harmful as she is. So we have an episode where this happens, and then our character goes to a trans therapy group. We got permission from the people. This is a real group. Our documentary filmmakers did this, and it's quite moving about what it means to be trans. And I should send it to Nancy Mace's office, and she could see like the damage she's doing. It's real damage.
If you're not careful, not all stories help to generate a better understanding. Some, like in the film John Q, unintentionally spreads misinformation that distorts the public's understanding of healthcare and the real barriers that exist. He points out that while the film had great performances from Denzel Washington, the underlying premise is unrealistic and flawed. Dr. Bear explains how missteps like this can erode trust and why accurate, responsible storytelling is more important now than ever, especially when the stakes are so high.
Oh, absolutely. I tell my students to watch the movie John Q with Denzel Washington. It's the worst thing ever. It's like I ask them to find misinformation. It's rampant throughout the whole movie. So this is about a guy who takes over an ER. I love Denzel Washington's performance in movies. It's not Denzel Washington, it's the writing of this movie. He takes over an ER. It takes it hostage. It's with James Woods and the late Anne Hesh as doctors, and because his son can't get a heart transplant. We have so many issues with the healthcare system, but it's lifted the lid off the rage. A company that denies 1/3 of its claims and makes, what was it, $12 billion in profit. There's a lot of rage. And so this is a movie that was done many years ago, but I don't think it's conducive to, the issue. We had a lot of kids who families couldn't afford transplants or have even insurance, and they got transplants if the heart was available. And so it was like a straw man thing. It's like, there's so many things you could do that are so bad. And so I love using that movie because it's just filled with misinformation. So that's a great example of something like that. I can understand why someone would be upset and would do something bad, but make it for reasons like, I think a Law and Order did something similar about someone dealing with the insurance industry like in the late 90s, I think. So this is not a new problem. It's just there's so much anger in these times. Anger is being released. I mean, to focus on a trans issues like puberty blockers, where I spoke earlier about how utterly ridiculous that is. Why are we still allowing it for cis kids in some places, or in Europe, in the UK? Why aren't we focusing on adequate health care? Why aren't we looking at type 2 diabetes, which is, how much do we spend on type 2 diabetes in the United States a year? $330 billion, some crazy amount.
Why is healthcare so expensive in the United States? Dr. Bear shares his frustration with a system driven by profit over care, from skyrocketing insulin costs to inaccessible preventive treatments. It's a conversation about what we value as a society and how storytelling can highlight these urgent issues.
Another disease that's pretty preventable, why are we not going to make GLP and GLP-1, available through insurance? It's going to be a pill soon. So how are we going to deal with all these things? Because it's always about profit. In the United States, I injured myself helping someone with her luggage on a plane going to Paris, and I had to have my distal bicep tendon repaired. To go to the ER, see an ER doc, go to the radiologist, have the radiologist do the ultrasound, see the anesthesiologist, have the operation, be there for a day, but not overnight, costs $4,000. How much would it cost in the United States? I don't know, 60, 70,000, something. I mean, it's outrageous. And now that should be number one topic. How do we deal with the outrageous costs of healthcare in the United States? How much of healthcare is paid on insurance? How much of our healthcare dollar is insurance? I think I looked it up. You'd have to check. Something like 28 cents, 31. I mean, something ridiculous. Does it employ a lot of people? Yes. Do we have to take account of that? Yes. Do we have to think about how to move them into other kinds of employment? Yes. But does that take precedence and profit for these companies over healthcare? Is that what America wants to be? A free market healthcare? It's not working. So that's why did it not work? Because people didn't have insurance, or they had a prior, documented disease. So are we going to go back to that? Healthcare bankrupts people still. Doesn't in France. They have caravans going to get insulin when it was up to like $300 and something. We did that on Designated Survivor. It's outrageous. How much does insulin cost to make? Not very much. How are they able to do that? Well, they patent it by changing the molecular structure slightly. They say, well, we do all this research. And did they pay for the patent? No. Insulin's been around for many, many years. So it's pure profit.
Through this conversation, we're reminded of the power of stories to spark change. Dr. Beer's work challenges us to think critically about the world we live in and the systems that we rely on. The question now is, what stories do we want to tell to create a better future? Coming up in the final part of my discussion with Dr. Beer is the first of its kind graduate program that blends media, science, and health, making these skills accessible to anyone with an interest. That's next time on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.